Hi everyone, I'm Dr. Neena. I'm a trained maternal-fetal medicine specialist from India and currently practicing in UK. So here I am to share few tips about the air travel in pregnancy. I know it's not very common to have an air travel in pregnancy, but especially when we are living outside our home country and when we are having certain feelings during pregnancy for traveling to travel destination places during pregnancy as well as to travel back and forth from home country to work country, then this is a necessity. So, regarding travel in pregnancy, air travel in pregnancy, most of the people think that it is not safe to have an air travel in pregnancy, but yes, it can be done when it is a necessity. Especially, it can be done smoothly during your second trimester of pregnancy, that is between fourth month to 6 months of pregnancy. And many people prefer to travel during 4 to 6 months of your pregnancy. Why not? You cannot travel in your first 3 months of pregnancy? Yes, of course you can travel. It is not sure that the air travel in pregnancy will increase the risk of miscarriage during the first 3 months of pregnancy by its own, though the risk of miscarriage during the first 3 months of pregnancy is common, which is 1 in 5, and it is not contributed by the air travel in pregnancy. But most people prefer not to travel during the first 3 months of pregnancy because they might have had some nausea, vomiting, and maybe tired, so they prefer not to. And what is the safe time to travel in your third trimester of pregnancy? Yes, any time before 37 weeks of pregnancy is a safe time. And actually, the cutoff period of pregnancy, which the airlines allow your travel, air travel, depends upon each airline. Some will allow up to 36 weeks, some will allow up to 34 weeks of pregnancy. But as a blanket rule, usually we tell around 37 weeks of pregnancy, it is a safe limit for if you have carrying one baby. But if you're carrying more than one baby, like in case of twin pregnancy, triplet pregnancy, the safe time to put would be like 32 weeks of gestation. Now, anytime if you're planning to travel after 28 weeks of your pregnancy, that is after 7th month of your pregnancy, you may be asked to produce documents related that your fitness certificate from your doctor or your midwife for the airlines verification, and it is important that you inform the airlines that you are pregnant. Another concern which was raised by some women to me was, is it safe for the baby as well as for them during pregnancy to pass through the verification, the security check? Does it have a radiation exposure? It does have a very, very minimal radiation exposure, but it is not harmful to the baby. And also, overall, taking flights have got a very less radiation exposure to the baby as well as to you. But unless you are a very frequent travel, if you are taking very likely not taking so many air travel during pregnancy, very less number of flights and not frequent, then it is not shown to have any harmful effects on your baby, especially regarding the risk of radiation risk. Another important concern is whether they need to take any additional precautions if they have to do air travel in pregnancy. So, the most important thing which you need to find out is whether you are going for a short haul flight or a long haul flight. What is the short haul and the long haul? The duration of the flight is what matters. If the duration of the flight is less than 4 hours, it is called as a short haul flight. In that case, it is not found to have increased risk of any complications like blood clots. The one risk which can be associated with prolonged immobility is increased risk of having blood clots in your legs especially, but it is less when it is less than 4 hours of flight. But if it is a medium or a long haul flight, more than 4 hours air travel, then the risk slowly increases. So it is advised to use the compression stockings or the support stockings, which you'll be able to get from your pharmacy or you can ask from your doctor. And also, if there are additional risk factors which was pre-existing to have developing a blood clot, like certain thrombophilic conditions or previously already having had a blood clot in the body, or if they have got any other risk factors like increased weight, like obesity. So there are certain pre-existing risk factors which already increases the risk of blood clot in the body. In these cases also, we advise to start on the stockings. Along with that, it is advisable to start them on the blood thinning agents, which is called as a heparin, under the prescription from the doctor only. Now, once you are started on this heparin, it will be advised to continue the heparin on the day of the flight as well as for few days afterwards, in order to reduce the risk of having blood clots. But this is only if you have got any additional risk factors of having blood clots, and that too by assessment by a doctor and then prescription from a doctor only. You cannot take it by yourself, and it is not safe to take these medication by yourself. So any air travel during pregnancy, it is always advisable that you keep yourself very active even during the flight, and prefer to have an aisle seat and be active. Take a small walk every 30 minutes or so. Hydrate yourself very well. Take good amount of glasses of water in between. Try to walk, and at least try to move your legs and do some calf exercises or some exercises with your legs, and try to be active every 30 minutes or so. And along with that, put on this compression stockings. And as I've already mentioned, overall, the air travel in pregnancy will not increase the risk of the pregnancy, or will not contribute to any pregnancy complications like miscarriage or having a preterm labor or an early rupture of the bag of membranes. But in case if this emergency happens, it is not always assumed, it cannot always be assumed that the crew members or any person in the flight will be able to tackle these emergency situations, though they have got a first aid available in most of the airlines. In that case, a pilot will have to do some emergency landing or something to help you in such situations. So I hope I have answered almost all the common queries associated with air travel in pregnancy. If you have any further queries, please let me know. You can type your questions in your chat box and I'll try to answer those questions. Thank you.